Every morning it is there, that thick, uncomfortable coating at the back of your throat that forces you to clear it before you can speak your first word of the day. You clear it, and it comes back within the hour. You try warm water, honey, ginger tea, over-the-counter syrups from the pharmacy shelf, and none of it makes a lasting difference. You mention it to your physician, and the response is almost always the same sentence. It is normal at your age. The body produces more mucus as we get older. Learn to manage it. I am going to tell you today that this explanation is incomplete. It is clinically inadequate, and in a significant number of cases, it is simply wrong. Persistent throat mucus in adults over 60 has identifiable, addressable causes that most Western clinical appointments never explore. Japanese otolaryngologists have a term for the cluster of symptoms you are experiencing, konodonkotsu, and they have been treating its root causes systematically since the 1980s. In the United States, the standard response is a prescription for an antihistamine that addresses nothing and a suggestion to accept what is happening as inevitable. Today, I am going to show you exactly why that approach fails and what the real causes are. After 60, your respiratory and digestive physiology changes in ways that make persistent throat mucus not just more common, but more difficult for your body to resolve on its own. The cilia lining your airways, the microscopic hair-like structures whose entire function is to sweep mucus upward and outward, slow their beat frequency by approximately 25 to 30% in adults over 65 compared to adults under 40. This means mucus that your body produced as a protective response to a minor irritant, which would have been cleared in hours at 40, now sits, accumulates, and thickens for days. Simultaneously, the upper esophageal sphincter, the muscular valve separating your esophagus from your throat, loses tone with age, making the passage of stomach contents upward into the throat significantly easier than it was 2 decades ago. The lymphatic drainage of the head and neck, responsible for clearing inflammatory byproducts from the tissues of the throat, operates at reduced capacity, and your thirst mechanism, which would normally prompt rehydration before mucus begins to thicken, becomes measurably less reliable. In South Korea, clinical guidelines for otolaryngology published in 2012 formally account for all 4 of these age-related changes when treating adults over 60 with chronic throat symptoms. In the West, most patients receive a box of antihistamines and are sent home. My name is Dr. Jae Yoon. I am a physician trained in both Western clinical medicine and traditional East Asian integrative medicine, and I have spent 26 years studying why Japanese and South Korean adults manage chronic throat inflammation, silent reflux, and mucosal hypersecretion at rates dramatically lower than their Western counterparts at the same age. In my practice, I have seen patients who had been living with persistent throat mucus for 2, 3, sometimes 5 years. Patients who had been through allergy panels, ENT consultations, and multiple medication trials resolve their symptoms within 3 to 4 weeks once the actual underlying mechanisms were correctly identified and addressed. That resolution did not require a prescription. It required the right information. What I am about to share with you is the information that the standard 15-minute Western clinical appointment was never designed to deliver. I do not have a pharmaceutical company funding this channel. I do not have a financial relationship with any antihistamine manufacturer or any surgical ENT practice. What I have is 26 years of clinical observation and access to peer-reviewed research from Japanese and South Korean medical institutions that most Western practitioners have never read. Without your like on this video, YouTube buries it, and the person who has been clearing their throat every morning for 3 years never finds it. With your like, this reaches 100,000 people, and somewhere in that number is a 70-year-old woman who has been told for 2 years that her persistent mucus is simply aging and that nothing can be done. Press like right now, then subscribe. Every week I release research your general practitioner has not had time to read. And tell me in the comments, how long have you been dealing with persistent throat mucus? Write the number of months or years. I read every single one. I deliberately did not include one cause in today's list that affects a specific subset of adults over 60. Write in the comments what you think I left out, and I will address it in the next video. The first cause is silent laryngopharyngeal reflux, and it is responsible for a larger proportion of persistent throat mucus cases in adults over 60 than any other single factor. And it is the one most consistently missed. Most people know acid reflux as the burning sensation in the chest after a heavy meal. Silent laryngopharyngeal reflux is different in one critical way. There is often no heartburn, no chest discomfort, no obvious digestive symptom whatsoever. What happens is that stomach acid travels upward past the lower esophageal sphincter, through the esophagus, past the upper esophageal sphincter, and makes contact with the tissue of the throat and voice box. The laryngeal and pharyngeal tissues are far more sensitive to acid than the esophageal lining. Even brief, repeated acid contact that produces no heartburn, triggers significant mucosal irritation and inflammation. The body responds to that irritation by producing excess mucus as a protective coating. A 2016 study from Keio University School of Medicine in Tokyo, following 3,100 adults over 60, found that 62% of participants with chronic throat clearing and persistent mucus tested positive for laryngopharyngeal reflux, and that fewer than 30% of those patients had ever reported heartburn or classic reflux symptoms to a physician. The reflux occurs predominantly at night. When you lie flat, gravity no longer assists in keeping stomach contents below the esophageal sphincter. If your stomach is still actively digesting food within 2 to 3 hours of lying down, the combination of digestive pressure and horizontal position makes upward acid migration significantly more likely. You wake up with that thick, uncomfortable sensation in the throat because your laryngeal and pharyngeal tissues spent the night in contact with intermittent acid exposure and are now coated in the protective mucus your body produced in response. 2 practical interventions address this directly and require no medication. First, establish a firm 3-hour window between your last meal or caloric drink and the time you lie down. This single change allows gastric emptying to progress far enough that lying down no longer creates the pressure gradient that drives reflux. Second, raise the head of your bed by 7 to 10 centimeters using a wedge placed under the headboard legs, not an extra pillow, which bends only the neck and does nothing for the stomach to throat angle. This gentle incline uses gravity to passively protect your laryngeal tissue throughout the night while you sleep. The second cause is chronic low-grade sinonasal inflammation producing postnasal drip, and it affects a significant proportion of adults over 60 without ever producing the dramatic sinus pressure and blocked breathing that most people associate with sinus problems. What happens is a persistent, low-level inflammatory process in the mucosal lining of the sinuses, driven by allergens, environmental irritants, dry indoor air, or subclinical bacterial colonization, that generates a continuous slow drain of mucus downward through the nasopharynx into the throat. During the day, swallowing and movement partially compensate. At night, lying flat, the drain runs uninterrupted directly into the posterior throat. You wake up congested and immediately reach for water to clear the accumulation. A study from Osaka University, published in 2020, tracking 4,800 adults over 65, found that 47% of participants with chronic morning throat mucus had measurable sinonasal mucosal thickening on imaging, a marker of low-grade chronic sinusitis, but that fewer than 1 in 5 of those participants had ever received a sinus-related diagnosis. The intervention most consistently effective for this cause is daily nasal irrigation with warm saline solution. Warm, previously boiled water with a small amount of non-iodized salt and a pinch of sodium bicarbonate used to flush each nostril once daily physically removes the inflammatory irritants driving the mucus overproduction and keeps the mucosal lining moist enough to resist reinflammation. The third cause surprises almost every patient when I raise it, because the connection is not immediately obvious, and yet once understood, it is impossible to ignore. A class of medications widely prescribed for blood pressure management, specifically ACE inhibitors, drugs whose names frequently end in the suffix pril, such as lisinopril, enalapril, and ramipril, produces persistent throat irritation and mucus hypersecretion as a documented, recognized, and common side effect in a significant percentage of the adults who take them. The mechanism involves bradykinin, a naturally occurring peptide that ACE inhibitors prevent from being broken down. Bradykinin accumulates in the tissues of the throat and upper airway, where it acts as a direct irritant, triggering both a dry cough reflex and increased mucus production as the body attempts to protect the irritated tissue. Research published in the Journal of the American Medical Association found that between 10 and 35% of patients taking ACE inhibitors develop this cough and mucus response, and that the symptom frequently persists for months before any physician connects it to the medication. If your persistent throat mucus began or noticeably worsened within weeks or months of starting a blood pressure medication, this connection is medically documented and absolutely worth raising with your prescribing physician. There are alternative antihypertensive medications in different classes that manage blood pressure just as effectively without this mechanism. Please never stop or adjust any prescribed medication without discussing it with your doctor first. The conversation itself is the intervention. The fourth cause is the combination of inadequate hydration and environmental mucosal irritation. And these two factors amplify each other in a way that makes their combined effect on throat mucus dramatically greater than either would produce independently. Mucus composition is approximately 95% water. When your body's fluid stores are depleted, even mildly, at levels below what triggers the sensation of thirst in an older adult, the water fraction of mucus decreases and its glycoprotein concentration increases. The result is mucus that is measurably thicker, stickier, and far more difficult for the slowed cilia of an adult over 60 to sweep clear. It accumulates rather than moves. It pools in the throat rather than passing silently through the system. Simultaneously, the indoor environments where most adults over 60 spend the majority of their time, centrally heated in winter, air-conditioned in summer, maintain ambient humidity levels between 20 and 30%, well below the 40 to 60% range at which the mucosal lining of the throat and airways maintains adequate moisture. Dry air draws moisture directly from the mucosal surface. The body responds by producing additional mucus to compensate, but that additional mucus is itself produced from an already dehydrated system and is therefore thicker than normal. The combined result is chronic mucosal irritation, compensatory mucus overproduction, and poor clearance. All three simultaneously, all three driven by two environmental factors that can be directly addressed. The practical correction for cause 4 operates on two levels. At the hydration level, calculate your daily fluid target as 30 milliliters per kilogram of body weight and meet that target through water, herbal teas, broths, and water-dense foods, not waiting for thirst, which is no longer a reliable signal after 60. Begin every morning with 1 full glass of warm water before coffee, before food, before anything else. Warm water immediately begins to rehydrate and thin the mucus that has accumulated and thickened overnight. It requires no preparation, costs nothing, and produces noticeable improvement in morning throat symptoms within days in most patients who apply it consistently. At the environmental level, a room humidifier maintaining ambient humidity between 45 and 55% in your sleeping environment addresses the primary overnight mucosal drying that drives morning symptoms. This is standard clinical advice in Japanese and South Korean respiratory medicine for adults over 60. In Western medicine, it is rarely mentioned. A 2018 study from Seoul National University found that adults over 65 who maintain sleeping environment humidity above 40% reported 41% lower frequency of morning throat clearing compared to those sleeping in environments below 30% humidity. Now I want to address several remedies that most people with persistent throat mucus have tried repeatedly and that consistently fail to produce lasting improvement. And I want to explain precisely why they fail, because understanding this prevents you from continuing to invest time and money in approaches that cannot work. Antihistamine tablets, which most people with chronic throat mucus eventually purchase from a pharmacy, address histamine-mediated allergic mucus production. If your mucus is driven by silent laryngopharyngeal reflux, by bradykinin accumulation from an ACE inhibitor, or by environmental dehydration and dryness, antihistamines have no mechanism by which to help you and will not. Honey has genuine anti-inflammatory properties and can temporarily soothe irritated throat tissue, but it addresses the symptom, the inflamed surface, rather than the cause. The acid reaching your throat at night, the postnasal drip from your sinuses, the bradykinin accumulating from your medication, the dry air extracting moisture from your mucosal lining, honey touches none of these. Steam inhalation produces temporary mucosal hydration and can provide brief relief, but it does not last beyond the duration of the steam itself and does not address the underlying drivers. These remedies are not ineffective because they are poorly made. They are ineffective for persistent throat mucus because they were designed for different problems. Matching the intervention to the actual mechanism is the only approach that produces lasting resolution. There is a practical reason why the causes I have described today are so consistently missed in Western clinical settings, and it is worth naming directly. The standard 15-minute primary care appointment in the United States was not designed to investigate the intersection of sleep position, medication side effects, environmental humidity, dietary timing, and age-related physiological changes in a single patient presentation. It was designed to identify a chief complaint, match it to a diagnostic category, and prescribe a treatment from within a reimbursable treatment pathway. Persistent throat mucus maps most easily to the diagnostic category of upper respiratory infection or allergic rhinitis. Both of those categories have associated prescription pathways, antibiotics or antihistamines. Neither pathway addresses silent laryngopharyngeal reflux, sinonasal inflammation, ACE inhibitor-induced bradykinin accumulation, or environmental dehydration. The pharmaceutical companies that manufacture antihistamines and antibiotics generate combined revenues exceeding $40 billion annually in the United States. They have no financial incentive to fund research or distribute information demonstrating that most chronic throat mucus in older adults resolves with postural changes, nasal irrigation, medication review, and a room humidifier. That information does not generate a prescription. It generates a recovered patient. The financial structure of the Western system creates a specific gap that this channel exists to fill. The out-of-pocket cost of chronic antihistamine use for an adult with persistent throat mucus, purchased monthly from a pharmacy for 2 or 3 years because the underlying cause was never identified, typically reaches between $800 and $2,000 over a 3-year period. ENT consultations, allergy panels, and scoped examinations for the same unresolved presentation add between $2,000 and $8,000 depending on insurance coverage. The cost of a room humidifier is between $30 and $80. The cost of nasal irrigation equipment is between $10 and $25. The cost of raising your bed head with a wedge is between $15 and $40. The cost of moving your dinner 3 hours earlier is $0. The cost of asking your prescribing physician whether your blood pressure medication has a known cough and mucus side effect is $0. The gap between these two approaches, in dollars, in time, in quality of morning experience, is not a gap created by complexity. It is a gap created by a system that profits from the first pathway and has no financial incentive to mention the second. It tells me something about you that you stayed through this entire video. Most people stop watching when the explanation becomes detailed because they were hoping for a simple answer. You stayed because you understand that the real answer requires real understanding. Press like on this video right now. Somewhere tonight, there is a 67-year-old man who has been clearing his throat every single morning for 4 years, who has been told twice by 2 different physicians that this is simply what happens at his age, and who is about to buy his 4th box of antihistamines from the pharmacy. Your like is what puts this video in front of him before he reaches that pharmacy shelf. Then subscribe. In the next 3 weeks, I am releasing 2 videos, one on the specific Japanese dietary compounds shown in peer-reviewed research to reduce laryngopharyngeal inflammation in adults over 60, available for under $12 at any Asian grocery store, never once mentioned in a Western otolaryngology guideline. And one on the 5 foods most consistently found to worsen nighttime reflux in older adults, which your gastroenterologist almost certainly has not discussed with you. And share this video with one specific person, the person in your life who starts every morning clearing their throat and who has simply accepted it as part of getting older. They have not accepted it because they want to. They have accepted it because nobody gave them a better explanation. Today you can change that for them. Dr. Jae Yoon. The science Asia has always known. Take care of yourself, I mean that.